Wellness for Life is brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership, CHI St. Joseph's Health Weight Management Center, and Natural Alternatives.
Hello, I'm Matt Koffenberg, physical therapist and owner of Purim Physical Therapy. Today I thought I'd talk about something that is receiving quite a bit of national attention, really because of the Olympics. If any of you watch the Olympics, particularly the swimming, you notice some of the swimmers like Michael Phelps had these big red marks on their backs or their shoulders. And he received a treatment called cupping. So I just thought I'd talk a little bit about cupping today, what it is and what is the research behind it, what is it used for. And then we'll do a real quick demonstration of cupping. So what exactly is cupping? Cupping really is the use of these devices that are called cups, and you place the cups directly on someone's skin and you create a vacuum inside the cup, and that in essence pulls up the skin, it pulls up the fascia inside the cup, which really ultimately then stretches the muscles out, and it's used to it's used really, in my profession, it's really used for chronic pain. Someone who's had pain for a really long time, sometimes cupping really helps ease that pain because you're getting a nice deep myofascial and muscular stretch. How cupping works, we really, there have been some studies that are trying to determine how cupping works. What is the mechanism behind why cupping works? There's one theory called the biomechanical theory, which really states that we are literally just stretching that tissue out and we're lengthening that tissue, ultimately decreasing pain. However, there are a couple of other theories. One of them is, it's called the metabolic theory. What that is talking about is that it actually changes the blood flow in the area. When you pull the tissue up into the cup and create that vacuum, you actually are creating what's called a hypoxic environment where there is no blood flow. But as soon as you take the cup off, you get an immediate rush of blood to that area, which is thought to warm the area up, which is thought to be therapeutic and allow the pain to go down. The other theory that's proposed is called the neuronal theory, and that is telling us that perhaps the cup is changing the way our brain processes pain. So you stick the cup on the area and it creates a different feel or a different sensation, and then our brain just kind of processes that pain differently, ultimately hopefully reducing our sense of pain. Historically, cupping has been used for thousands of years. The first known evidence of cupping was from an ancient Egyptian medical text from 1500 BC. So thousands of years. This cupping has been used for a long time. Cupping has also been used in China. The first known use of cupping in China was in 150 BC. Initially, most of the text that has been shown with cupping, the cupping was initially utilized to drain boils. It was used to extract blood. For the Chinese, it was used to change what's called our qi. The Chinese believe that our body is full of energy called qi, and the cups were thought to potentially allow the qi to flow a little more. So if someone had pain, it was because the energy was blocked in that area, and the cup was to allow that qi to flow through their area and decrease their pain. What is the research behind cupping? So in 2006, a gentleman by the name of L.M. Tam did a study to determine where the tension was within the cup. And he did find out that the muscle did undergo tension with the cup. So that's good to know that once we have the cup in place, we are actually tensioning the muscle. In 2009, Kim and others did what's called a systematic review, which is where they take all of the research out on cupping and try to pull it back in together and develop a hypothesis or develop some key data points. And what he determined with this systematic review, he looked at one particular study by a gentleman by the name of Huang, Huang, and it was specific to low back pain. It was how did cupping help versus medicine? So he compared the two. So 57% of the cupping group reported a greater than 70% pain relief versus only 27% within the medicine group. There's several other studies. There's actually some studies with cupping and the use of carpal tunnel that has shown that people have had like a 36-point reduction in pain on some certain scales. So there is some research out there. However, there isn't a ton of research, and most of the research there has been small sample sizes, so we can't really draw firm conclusions with the effectiveness of cupping at this point. I do want to do just a real quick demonstration of cupping. So when you place the cup on a client, really again you're trying to create a vacuum. So as I pump this up, you'll actually see the skin and the fascial system kind of come up into the cup, and the cup will stay there. And usually we'll put multiple cups on, so I'll just put a couple on, and we'll pump this up. And you'll also see that the skin now is actually changing color. That's because we're altering the dynamic flow of the blood in that system. So once you have the cups in place, you then actually want to try to start moving the cups around. And you'll notice as I'm moving the cup, how much of this tissue is being moved. It's a great way to stretch that tissue. Treatment typically is 10 to 15 minutes. Release the vacuum, and we are done. If you have any questions about anything, please don't hesitate to call me at 218-346-2464.
Thank you for watching Wellness for Life. Brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, Mojave Ottawa Community Action Partnership, CHI St. Joseph's Health Weight Management Center, and Natural Alternatives.